Hello there, and a huge welcome to the It's Not Your Fault World Mental Health Forum Summit. Today I'm joined by a group of very erudite people who are going to help explore the whole issue of health and of mortality in terms of children, and particularly children in care. I'm joined by some amazing people. And so I don't get it wrong, I'm going to invite them to introduce themselves. So, Nicola, could you start us off, please?
Hello everyone, my name is Nicola Asbasher. I am a nurse and health visitor, and I have been a specialist nurse for children in care, and more later I have been working in the area of child death review as a nurse supporting families following the death of their child.
Thank you very much. Kenny.
Hello everyone, my name is Kenny Gibson. I'm a mental health nurse and midwife for the past 44 years, and I've got the humbling privilege of being the current national head of safeguarding for the NHS. Thank you.
Thank you. And Nicola, we've got two Nicolas today, but second Nicola.
Thank you. My name's Nicola Mundy. I'm child wellbeing professional, lead for learning from child deaths. I sit in the Surrey Child Death Review Partnership and have a public health role within the team. I've been working in public health for the past 35 years.
Thank you. And Sylvia.
Hello, I'm Sylvia Stoyanova. I'm the Deputy Program Director of the National Child Mortality Database. We're a program based at the University of Bristol. The program is funded by NHS England, and we collect and analyze information that's coming from the child death review process in England. So we started data collection on 1st of April 2019, and we are ongoing and do analysis and research on deaths of children between 0 and 14. And 17, from that date.
Lovely, thank you. Health is such a big issue for us all, but if you're a child at risk, whether that's you're in care or you're not in care, I think that's something that is such a pertinent topic for us all to consider. We spoke very briefly before we started this interview about it's much broader than just children in care or just children who are at risk for whatever reason from it's broadening it out to how as a society we look at how do we prevent the problem in the first place, what do we learn when things go wrong. And so often there's a big splash in the newspaper about things have gone wrong and isn't it terrible, and then you wait for the next one. So I would really like, if you would, for each of you to explain how you contribute to either information or practice that enables us as a society to better able to keep children safe. Terry, as a safeguard, Kelly, as a safeguarding, across the UK, what for you are the most important things? What's the message? What do you do, and what's the message you'd like to get out?
The message has changed over the past decade. If this was a decade ago, we'd be talking about removing children for child protection reasons. But more recently, we've learned to support families, keep children at the heart of their family, particularly extended families and kinship families, etc. So there is a more broader approach to trying to support families with that. I also think we've come to understand the lived experience of children in care far greater by listening to their voice. We've some way to go to get full progress, but I do think we're listening to that because there's not only children in care, but there are children on the edges of care, and there's children being cared for within the care sector in various venues now that are still health venues. I'm thinking particularly about looked after children that might find themselves under the care of the security state or youth custody or other types of healthcare providers. And I'm also thinking about looked after children through not anything of their own fault, might be party to a child protection plan where we've had to remove them from their family and all that trauma. So I think certainly over the last 10 years, we've become more cognizant that each child in care has a unique journey, And sometimes that journey, we've got to be cognizant of the trauma that they've suffered and the impact on their cognitive processes, their recovery process, their trauma-informed processes. And we're getting better at it as a team. We need a collection of health practitioners to bring that child to recovery.
I think the issue of whether young people have trauma and if they've been taken into care, particularly with a protection order, I think it's a pretty safe bet to say that they will have experienced a range of trauma by the time they are established in whichever, whether it's foster care, adoption, residential care, or so on. And one of the things that strikes me is when you look at the statistics about the number of young people who go through the care system who suffer from mental ill health. And I wonder which of you feels that you'd like to speak to that particularly, because I think it's such a big issue. Who of you do you think?
I'd quite like to come in if that's okay. One of the things for me in terms of mental health is that connection and belonging and attachment. So I am also a PhD student on the side, and my PhD is actually focused on attachment theory and trauma-informed practice, particularly looking at families when they've lost a child who was subject to a child protection plan at the time of their death, and how those kind of connections and attachments are sometimes different to the wider population. And actually, I think if you were to put that in relation to a child who has joined the care system through whatever reason, through whatever cause, they've lost not only their attachments to their networks, their family, their friends. They may have also come with an attachment kind of difficulty through childhood. So we know that attachment's talked about frequently and broadly, and if you were to look at a child who has had experiences of maltreatment or anything like that, their attachments are quite often insecure or disordered or something to do with that. And if you've got that as your inner working model and your kind of stability that you go back to, particularly at times of crisis, we find ourselves reverting back to whatever we know historically, and you pick that child up and you put them somewhere new. They come not only with the trauma of whatever they've experienced in terms of the incident or being in care, but they also sometimes come with that kind of difficulty in forming relationships, in belonging, in feeling connected to people. And I think that well-being and positive identity are two of the things that really these children need support with and focus with, and then that in turn impacts your mental health and your ability to cope wider. And with one of the things I've always thought about is when we move children from placement to placement, and how that then rocks those connections and that belonging again, and also staff changeovers and things. You know, we try to recreate that family atmosphere wherever we place children, but ultimately it never quite will hit the mark of being in their family. So as Kenny said, we've come a long way in trying to keep families together wherever we can. And it's about recognizing that trauma for those children and being active in being trauma informed to break down barriers and open services to make them accessible as much as we can, with the knowledge that these children will have experienced difficult life experiences. And you know, we all rely on family in one way or another, and to not have that at your fingertips when you're an impressionable young child of whatever age is something that's always going to impact mental health. And trying to keep families together, even if it can't be every day, it can sometimes be. Sometimes that's also a key way through life story work and keeping those connections and attachments going.
I think you're absolutely right. What strikes me is my understanding of attachment disorder is not only does it affect things like relationships, but also our capacity to organize, to keep time, to trust, to do so many things. And when my background is I was a head teacher for 20 years, and although I've had my own business now for 20 years, it was one of the things that we looked at is, were there issues around attachment, with whether the children were looked after or within their family home, and that the impact that had was far-reaching, and more children were being affected by attachment disorders of one way or another. But there is no doubt then that if you move children from place to place to place, that you are constantly reinforcing that trauma and that sense that I can't trust people because I'm not going to stay. Why would I make a strong bond with someone because they're going to go next week or I'm going to go next week, which makes it very difficult.
And then you see that play out through behaviours. So I know that there's a move away from wherever possible that diagnosis of attachment has been problematic over the years, and some people believe in it heavily, some people shy away from it. But I think the one thing that does stay through all of the research is the behaviours that we see in terms of attachment. And you'll have children who become almost defensive because they don't want people to get close because they're scared of what's going to come next and who's going to come next as well. But then that attachment feeling for, if I take it to the connection, actually what you also sometimes find is that they seek out connection with people that may not have their best interests at heart, but produce a very lovely front page of gifts and you know, those sorts of things as well. So children who have had that instability can find themselves seeking connections and belonging and relationships with people who may not be the best influences for them or have their best interests at heart too.
Which is where grooming and getting involved in gangs and so on can become such a problem, can't it? Nicola, can I ask you, in terms of mental health, you know, what are your experiences and what are your views around the challenges that young people face?
I don't know if you've read, Gina, but there's the UNICEF published a document in 2021 about state of children's health, and what they talk about there is the importance of the early years in children's lives. So if you're thinking about teenagers and their mental health, the biggest impact in changing the outcomes, poor outcomes for children with teenagers with poor mental health, is working with families when they're young.
Yes.
So looking at that early support, and that's an issue, isn't it, at the moment, really, because there have been a lot of cuts to services for early years support and for families. So, but actually that's where we should be focusing our prevention and our resources, is supporting families to be able to parent toddlers and young children and supporting them then, because that will have the biggest impact in the long term. And that's what the evidence shows from the UNICEF report and the other evidence. It's that importance. So it's early attachment, isn't it? But it's also early parenting skills.
And it's not easy being a parent, is it? I mean, there's no blueprint that says this is how you do it and this is the right way and that's the wrong way. But yeah, early intervention and consistent intervention as needed, rather than crisis management at the end, always seems to me to be a better way. So Sylvia, I know perhaps you'd describe your work and how that your work informs, you know, the professionals moving forward.
Yes, I can talk a little bit about the child death review process in England. So this is a statutory process. So all child deaths in England, irrespective of the cause of death, of all children who died between 0 and 17 years in England, so up to their 18th birthday. If a child dies, then there needs to be a child death review process, which is a multidisciplinary review of the factors related to the child death. So it's a multi-agency, so everyone who has known the family in their professional capacity contributes to that review and discussion, with the outcome being learning from the deaths, so deaths are avoided in the future. So really it's forward looking as opposed to looking back and thinking, you know, what could have been done differently so that child didn't die. So there are other parallel processes for that, but the child death review process is really looking at the learning and the contributory, what we call the modifiable factors related to the child death. So this process has been in place since 2008. There is the legal basis for the data collection without consent from families, which is in the Children Act 2004. And in 2018, so 10 years later, we had a commissioned national system for collecting the data from the local review panels and analyzing it. So we then have an understanding of the national picture. And this is fantastic. There's no other country, as far as we know, that has this system in place. In some countries, they sort of focus on a smaller group of different sort of causes of death, but we in England have a complete coverage of the full mortality of children. And that's really helpful because child mortality is telling us how a society is doing overall. This is not only about how well the health system is functioning, it is about how we function as a society overall. It sheds light to that. And it's incredible that we have that and we can learn from it. And I should say that, you know, every child death is a tragedy, and it's a tragedy for everyone, for the community and for the families. So I want to sort of acknowledge that because I'm talking about child death here.
Absolutely.
So that's a little bit about the child death review process. We in Bristol, our team, as I said, analyzes the information. We publish thematic reports. So we publish reports on different topics every year. But we also publish something called Child Death Review Data Release. So that gives us a bit of an understanding of the trends in child mortality and what are the main modifiable and contributory factors. I wanted to talk a little bit about some of our thematic reports. One of the first reports that we published using the national data from the child death reviews was focusing on suicide in children and young people. This data was produced on 1 year of data collection, so that's deaths from 1 year of analysis that we did back then. We published it in 2021. But the main thing I would like to share here is that from that data on child suicide, we identified a wide range of factors that influence the mental health, and those included loss of key relationships, as Nicole was saying, household functioning, including domestic violence, also conflict within the household or within the relationships. And that is really important. And it's evidence that we now have from the lives of these children that we talked about in this report.
I think the big issue for me is what we do with that information. Having that information is a great tool, but ultimately it's how we as a society and organizations within that society respond to that information. What do we do as a society when we have so many young people who suicide? Thanks, Kenny.
I think it's back to a comment I said earlier that data and intelligence is critical at scale, but through the lens of either domestic violence or exploitation online, or even some of the contemporaneous child death reviews, what we're learning to do is focus on the voice of the child before and into self-harm, neglect in the household. And part of what we're trying to do there is learn to reflect on the journey as well as the data points, because part of our challenge with data is sometimes we may not be looking at the data from a child death review for at least 6 months to a year. But
Right.
there are things that we can learn during rapid reviews, local rapid reviews of child safeguarding nature. We shouldn't simply be learning from children's deaths. We should be learning about all harms, and we must do so as a collaborative partnership. Health needs to learn to share local intelligence about families and households, and even at times about specific children, with our partners in prevention. So our partners in education, schools, children who are not placed in schools, perhaps homeschooled. We must learn to share intelligence with our colleagues in trauma-informed policing and community safety partnerships. And we must learn to share our information with social services and housing, anyone that has a touch point with that child, that family, that household. Because remember, for children in care, they don't see themselves living in a family. They see themselves placed in a household. For many, some of them with more than 11 placements over a two-year period. So we've got to think like a child in care. We've got to think like, and we'll only do that by reflecting on their voice, reflecting on their journey. And that's a difficult task.
It is indeed. But I also want to make the point there'll be many people who are listening to this who are not in the UK. And I think whilst we're talking very specifically about the UK, because that's our experience, that the principles and the challenges are the same wherever you go.
I think you're right. The principles and challenges can be the same. Also, we've done a substantial piece of work with the Foreign and Commonwealth Office, because child safeguarding and the culture of, for instance, child chastisement is different
Yes.
dependent on cultural norms. The global society is not the average community that we have across Britain. So there are cultural norms, there are societal norms that sometimes, from a lens in the UK, can be extraordinarily abusive.
Yes.
But it's accepted behaviour. So yes, I think we've got to look globally, because some of that is happening within our communities, and it's certainly most certainly happening online.
Yes. And thank you for that. I think that's a very good point. And ultimately, every statistic is a life and will come with its own particular experience and baggage, won't it? And I think it's really important that we don't lose sight of that. Would any of you others like to add to what Kenny has said?
Just thinking about when you were saying about the life and the listening to the voice of the child and things, it is about keeping that individual in mind at all times. And I know that Sylvia talked about the findings of the National Child Mortality Database. Part of my job is working with a team of nurses who go out and visit those families. So we meet those families sometimes within an hour or two of their child's death. And it's really about listening to their stories, understanding that child's world that they were living in, and bringing that through the review. So by the time it reaches Sylvia and her team at the National Child Mortality Database, we've gathered as much as we can in terms of understanding not just the child, but the family's experiences, the kind of wider family, and understanding how they interact with society around them as well, because I think that's something we sometimes see as this child in isolation and their experiences. But actually, if you look at it from a kind of ecological systems theory, you've got that massive links to all places, including how the government influences that child's daily life and how school influences that child's daily life. And so it's never just about the parents and the small kind of microsystem around them. It's always much bigger than that. And we try really hard to bring that through, so that by the time it reaches the National Child Mortality Database, they've got a really rich kind of a selection of understanding the family at work. But it's also about supporting that family, because ultimately, whilst there is a child who has died at the centre, there is also a family and siblings and grandparents and people who are also grieving and left behind to survive after that. And I think that particularly if you think about children in care, it gets even more complex, because you have a family who are grieving at the loss of their child. You've then potentially got a foster family who might be grieving at the loss of the child. And then you've also got all of those other processes at play, the professionals who were looking after that child, the corporate parenting who are looking after that child. And so actually, if you look at it from that point of view, it's very complex to make sure that we think about it from that systems point of view, to make sure that we cover everything and learn as much as we possibly can from all the points through that child's life.
I mean, it is the worst that can happen, isn't it? As Kenny is saying, it's important we also learn not only from the deaths, but that information that comes from the data we have and from the process that Nicola, you describe, is absolutely crucial in understanding things better. It's the child death review process provides the support for the individual and the family. That's the first part of the process. So it's not only about generating data and some learning and then nothing happens. It is an entire process that supports the family. So that makes it, that's what makes it unique.
And what makes it so powerful, I think, because one without the other would be actually quite cruel, really, I think, to take the data and then leave people, off you go, we've got what we need, now go and deal with it, I think would be wrong.
What we can do, though, is when we get the data back from the National Child Mortality Database, their thematic reviews and everything are so crucial to us forming our learning and our services. So part of what we do at the kind of frontline of, so I sit in a provider and I in an integrated care board looking at providers and supporting providers in their kind of frontline work with families, is there's an awful lot, like the suicide thematic review that Sylvia was talking about, that has influenced our learning locally, and it has also influenced how our service design looks. It influenced what key messages we want to get out. And I know that one of the things we've been working on a lot locally is prevention of sudden unexpected death in infancy. And the work that we have produced locally, with the work of the National Child Mortality Database, with the work of the National Panel for Safeguarding, the Child Safeguarding Practice Review Panel, you bring all of those national data sets, all of those local data sets together, and what you've got is a really powerful tool with which to influence commissioners, to influence frontline practitioners, to influence managers, to influence the kind of decision makers as well. And what that then does is that changes how we interact with those families and how we support them, and what our focuses are, what messages we're making sure they have, what support we're looking for, how we design our mental health services, how we design our health visiting services, how we, it's kind of all services. So sudden unexpected death infancy, for instance, is one of the things that we've been looking at, which we use the data set from the National Child Mortality Database hugely for, is about making sure that message is for everyone, because historically it's always been about health visitors delivering that message, but actually all professionals who go into houses might be able to influence that and prevent that from happening. So I think, and the same with mental health, is those messages, those knowing what those risk factors were, looking back on what's happened, but using that to look forward, is so important when we work our service designs, so that those practitioners who might be a school nurse, or they might be a social worker, or they might be whoever they are, they know what they're looking for and they know how to support better. Because if we don't know what's happened and we haven't learned from it, we're not able to then kind of design the support that we offer the future as well.
Yeah, I think I thought we should say as well, though, that so these issues like suicide's complex, isn't it? The reasons behind suicide are complex, so the answers and the solutions are complex as well. So we don't have anything with an easy answer, do we?
No. I don't want to trivialize this at all, but it's a bit like having a 3D jigsaw puzzle of a can of beans, where you're trying to see where the connections are, but it's really very complicated, and lots of things look like one thing, but actually when you dig deeper, that there's more going on. We're going to go for a short break, but when we want to come back, in a way we've been talking about the family. I want to broaden it out in terms of, and particularly around mental health and suicide, to those who experience challenges in school and the community through social media and so on. Because young people, by the time they're 5, are going into school. I want to focus on mental health, or mental ill health rather, and suicide, and to just broaden it out to the complexity of things that can contribute to our mental health, that are outside the family, that children are subjected to in today's world. And just wondered who of you would like to start your thoughts about that.
Oh, thank you. I've the humbling role of sitting on the online National Crime Agency. And despite my 44 years working with mental health patients, including children, I am quite shocked to my core about the harm and impact of online harm that is caused to our young people, our children, mainly by adults, but also they're being coercively controlled to harm each other, so peer on peer. And I think it's something that I find very challenging to understand, the impact, the visceral biological impact of online harms, because it is not something that I was brought up with. It's very recent. So I get harm within a community. I get into familial or family harm. I understand that because I've listened, I've read cases, etc. And local practitioners tell us what it feels like, and children tell us what it feels like. But I'm totally at a loss to understand the impact of online harms at this moment. if I can just plant that as an unknown,
Yes.
Gina, it is really very serious. It's increasing at scale, almost at global epidemic proportions.
I think one of the challenges for all of us that are on this call, and for parents and grandparents and teachers, is that most of us were not brought up with the level of interaction with social media and with the internet, and the capacity and the speed with which you can uncover some pretty dark stuff very simply. It's beyond most of our ken. And it's what we do about it, and how can we safeguard young people when they have access to stuff over which we have no control.
Yeah.
I cannot, again, from the evidence we have from the report on suicide. So the role of social media and internet use was noted in at least 18% of the suicides. So from that 1 year of thematic review we did. So that included suicide-related internet use, for instance, searching for information on suicide, communicating suicidal ideas online, visiting pro-suicide websites and chat rooms. And they were 12% of the deaths were of child or young people visited suicide-related website or searched for information on methods of suicide. So for me, it is about doing something on a government level to make sure that this information is not available on the internet, and there's no other solution. So one thing that I feel very strongly about is when Nicola was explaining about the joint agency response, so when a child dies due to suicide, there would be a home visit and done by a doctor and the police. So that information on what the child could access from their phone or any other device from the house, that should be made available. We then know where that information is available and stop that. I think there's no other solution. Companies should be responsible for that. So
it's interesting how resistant those companies are to changing the rules so that children are protected. And I do believe that governments globally need to be doing far more to protect children in that way. But I suppose part of me thinks, how do we resource parents so they can support their children in terms of the use of the internet and so on, when most of them will actually, and what do they say? If you want something done that's technological, ask a 9-year-old, and they're likely to be able to do it better than you can. And I think that's the challenge, isn't it, at this point in history, when very often the children have more technical ability than their parents.
And
So
I think that the internet I think the internet moves so quickly. So even if you did identify a website or you did identify something, give it tomorrow, there'll be something else and it will have moved on, and there's a new app and there's a new, so it's really complicated because you've got to almost preempt all of these things.
Yes.
Apologies, Kelly.
So that needs to go hand in hand with education. So children need to be aware of, and awareness to be raised at school of suicide and how to protect themselves.
And that's again a fine line, isn't it? Getting the timing right so that it's age and emotional developmentally appropriate. Kenny, let's bring you in.
Yes, I think that cognitive development of technology is really useful because it has its advantages. For instance, neurodiverse children can thrive with a productive, positive, affirming use of technology, as we know. But, I do think we need to recognize the scale of what this is as harmful to mental health in children. So I just want to call out a welfare and self-welfare alert to here, because part of what we have to be careful about is not to over contribute to a phenomenon on social media whereby sometimes by calling it out we raise the acuity of the social movement and the harm online. But suffice to say that the National Crime Agency in any 1 month just before COVID, so we're talking about January 2020, we're looking at about 185,000 incidents of online child exploitation. Some of it sexual, but it was 185. unfortunately, that monthly number is now sitting at over 800,000.
Wow.
So that there has been an explosion, and I don't use that word dramatically, but as adults trying to understand the teenage young person's use of technology, we, out of that 800,000 incidents online, a third of them have been coerced children, peer coercing. So children are being groomed to coerce other children peer on peer. So, you know, it's the figures are all going in the wrong direction, and maybe it is about governmental imposition on technology companies, because we have artificial intelligence. We can monitor. The National Crime Agency knows it's 800,000 incidents, but where's the willingness to manage the tech providers?
It's an interesting question, and I think it's only when we keep raising this in programs and opportunities like this that we, I think, need to start putting the pressure. You know, people often say, "What can I do? I'm only one person." But if we collectively, as one people, stopped using some of these companies and said, "I'm not going to use you until you stop some of these things going on," I think that they would very quickly capitulate and do something different. Let's broaden it out to, many children complain that they are being bullied, and whether that's being bullied at school or online. We've got a generation of children, many of whom will talk about the fact that they see themselves as having mental health problems in a way that I don't ever remember that being the case. And I'm not sure, is it just that people are talking about it more, or is the problem bigger? So Nicola Mundy, what's your view? Is it that it's just more in the public domain, or do you think it is actually a bigger problem than it ever used to be?
Well, I wonder if some of it's our focus. So I think if we look at the evidence, what we should be doing is using a strengths-based approach to these issues with children and young people. But actually what we do is there's a lot of focusing on what the risks are. And then that scares children and young people. And actually, if we look at some of the campaigns that have happened in the past, they haven't been effective because they've scared children. And I was interested in what Kenny was saying before about the internet and social media. And actually, what we should be doing is supporting children and their families in a strengths-based approach about how to benefit from some of the advantages from the internet, rather than focusing on the risks. Because when we start to talk about the risks, we might start also to make children aware of some of the things that we don't want them to engage in.
So they get curious and go and have a look anyway.
Yeah. So I think that's something that as a whole system and from a governmental level, we should be looking at a strengths-based approach. So we should be looking at focusing on children's mental health and how we can support them with their mental health, rather than focusing on some of the very extreme ends of mental health. I think that's what the evidence shows in terms of how we can improve children's mental health.
And certainly building their confidence, their resilience, their capacity to have a really strong sense of self-worth, I think is really important. And whether you're talking about, whatever age children, but also with adults, because I think lack of self-worth is at epidemic proportions because so many people compare themselves to something that's not quite real. I've got a magic wand. I'm going to sprinkle a bit of fairy dust, and I want you to identify what are those things that you think are entirely possible that we should be doing either more of, less of, or we're not doing at all in order to improve the lot of children. And I'm going to start with Sylvia.
For me, is investing in the early years. That is absolutely the thing that I think should happen first, and we can do it. We can do it in a country like England. We've got the resources. We need more health visitors, we need more school nurses, we need public health nurses, we need school nurses in every school, primary and secondary, because that can help with mental health, that can help with chronic conditions to be managed better, that can help on so many levels, because again, this is not just about the health, but it's about the well-being of our children. So for me, investing in those early years, we see the biggest mortality impact is on the young children dying under the age of 1. So if we have enough health visitors, they can help families who are more vulnerable, families who might have experienced, the parents, young parents, or parents could have been caregivers themselves. So there's so many different circumstances and ways of people living and also families living in deprivation. So if we have more services to support families living in these different living conditions so their children can thrive, I think we can achieve a lot from public health. If you're thinking about reducing mortality, improving health, that's the group I would suggest we focus.
Brilliant. Thank you very much. Nicola Mundy, what about you?
I have to agree with everything that Sylvia's just said, really, because that's what I was going to say.
I'm really going to add to it, so you're not off the hook, I'm afraid.
And something I think also health visitors, but also we had some fantastic children's centres in the past that did a lot of family support as well as health visiting. That definitely, and something I think about investing in professionals as well, so we're not de-skilling our staff, so that we're looking at upskilling staff so that they can support families. And when you cut services, it means that people have less capacity to do some of this extra work that's really important if we're looking at the long-term health of our children.
I think it's really interesting, isn't it, how there are cuts in services, but they just push the cost, financial, social, emotional, whatever, down the road, and ultimately costs so much more. So I couldn't agree with you more. Kenny, we're going to go to you next.
Okay, I'm going to take 2 things. First is data sharing. Colleagues, regardless of which sector you work in, please, please, please securely share your concerns, your escalations and your information if you think it will help prevent harm to a child. So data sharing, be confident. But the other one is we spend our lives, Gina, looking at incidents and horrible, horrible moments. But we also have a responsibility to bring hope. Bring hope to children victims that recovery is possible. Bring hope to the system that recovery is possible. So data sharing and hope.
I think the need for hope, particularly in the care system, and I'm not just talking about the young people themselves, but I think also for the staff, those who, if I was in teaching, I'd talk about the chalk face, although you don't find many blackboards these days, but actually those staff who are really trying to do their very best in often incredibly challenging circumstances. And that's one of the reasons why Fatima and I are working so hard with the summit, to bring people together, to share information, to get people talking and using the same language, because we often use the same words but mean different things. And also to give that sense, that spotlight, which says we do care about you and that there is hope that things are going to be better in the now and in the future. So thank you for that, Kenny. I know I've left you to last, Nicola, and it's always hard to get last, but you're not off the hook, my darling. So the magic wand's going to you now.
I think, well, building on all of those, they're all amazing. And I'm always very conscious of the hard work and the dedication of all the services across the whole multi-agency patch, no matter what service you're working in. I talk to an awful lot of professionals on a day-to-day basis, reflecting their experiences and talking about what they've seen and how to learn from those experiences too. And I am, like you were talking about, I'm always mindful of caring for the carers, because if they haven't got that room left to care, then it makes their jobs even more impossible. As a health visitor, I think what Sylvia said was, and Nicola, absolutely, early years and early prevention and intervention are definitely key to my heart. But I think the biggest thing, as I started with, is that the building connection, getting people talking to each other, whether that is families who are struggling, whether that is children who are in care, whether that is professionals who are struggling to manage their day-to-day jobs with there's always, we hear it a lot in all the reports about the services being cut, or staffing problems, or money problems. And that is not just in, say, for instance, social care or the NHS or the police. It's everywhere. It's third sector charity. Everyone is really tight for money, and what you end up finding is all that wonderful magic that the professionals put on comes out more from their love and their passion and their want to do well than it does in service design and provision. So for me, I would say that my magic wand would be giving freedom to professionals to see what they need and what they feel that the people they're working with need, and being able to design local kind of things that are needed for the people that they're visiting, and really having that individual and that community focus in everything they do to build those connections. And I think ultimately that will help everyone, whether you're the professional, whether you're the family, whether you're the child, it'll help everyone in the long run.
I think that's so important, because so much has become centralized and almost vanilla, isn't it? That, we have this cookie cutter thing that if it works in one place, it's bound to work in every place. And that's not actually the reality. I suppose how I want to end up really this particular discussion is, a lot of it has been talking about the professionals and what we can do. And I think that I would be neglecting my role if I didn't finish this with, I think it's about engaging with those people who are finding it difficult and encouraging them to put their hands up and say, I need some help, and to be able to reach out to other people, whether that's to family and friends or to the professionals, in order to get the help and support that they need to do well. And I just wondered, in the last few minutes of the show, if you've got any thoughts about whether there's good practice going on that we can share, or whether you've got ideas about how that can be made easier for people. Kenny?
I think every one of us working in health and education, Gina, should be reverse mentored by a child in care and offer them career support to have a career in health or education, but I would say health. They make fabulous registrants, absolutely awesome healthcare colleagues.
I think that's an amazing idea. It's the first time I've heard of it, but I think it's absolutely brilliant. Thank you very much indeed. I mean, I know from my own experience in education that the children were greater teachers than the teachers very often. So thank you. Anybody else got a contribution they'd like to make in terms of what's going on that could work out well elsewhere? Nicola?
I was thinking about what you said about what can people do. I would say that we hear a lot about, that how difficult it is for people to reach out to services, things like shame and stigma. And when you're not coping, it can be really difficult to admit that you are not coping and that you need some help. But I guess for me, it's just reassuring people that as someone who works in these roles, please do just reach out and talk to people. We are always here for you. And if you don't get the response you need from the first person, then go to the second person, because, there is a lot of things that stand in the way. But ultimately, there is lots of people out there who want to help and will do their best to support anyone, any individual, any family, any child. There is always someone who will be, willing to help you. So do always ask for that help if you need it.
I think that's really important. And also, if you can't get through to the agency that you think is the right one, if there's another professional that you trust, whether that's a teacher or a teaching assistant, or it's the nurse at the local practice, to actually say to them, I'm struggling, and can you help put me in touch with the right organization? And I think that, there needs to be a bit of courage sometimes to admit that you are struggling, and we all struggle at times, don't we? And I think that ultimately it's not only having the courage to ask, but also when business professionals are very busy, to actually recognize sometimes those requests for help don't always come in neat little packages that we're expecting, and we've got to be mindful that they come in different ways and be responsive to that. We've pretty much reached the end of our discussion, but before we do, is there anything that you've not had an opportunity to say that you would like to share? So it just remains for me to say a huge thank you for joining me. I know you're all very, very busy, and thank you for listening. The details of how you can get hold of people will be in the show notes, but also to say to you that whoever you are listening, whether you are a parent, whether you are a professional, a member of the public, they do say that bringing a child is the responsibility of the village. And I would say every one of us has got a responsibility to be aware and to help so far as we can and make it possible for children to have a safe, secure, and happy childhood. So thank you very much for joining me. So please take care. Bye-bye now.